If strange bruises or red spots appear on your skin, it could be your first warning of internal bleeding. Most people miss these deadly signs until it's too late. Your skin is a mirror of what's happening deep inside your blood, and if you don't catch it early, the consequences can be fatal. Stay with me, because knowing what to look for might save your life. Tiny red or purple dots. Petechiae. They look harmless at first. Tiny red or purple dots on your skin, you might think it's just a rash. Maybe you brushed up against something, maybe it's just your age, but what if it isn't? What if these little spots are your first warning sign that something is going wrong inside your blood? Petechiae. That's the medical term for these pinpoint spots. They're flat. They don't itch and they don't fade when you press them. You might see them on your legs, your arms, or even your chest. They can look like freckles or broken capillaries. But here's the difference: petechiae aren't on your skin, they're in it. They're caused by tiny blood vessels, capillaries, bursting under the surface. And when that starts happening for no clear reason, it means your blood isn't behaving the way it should. In healthy people, these small vessels don't just burst. They're strong, elastic, supported by clotting factors in the blood that keep everything sealed and moving smoothly. But when something disrupts your body's ability to clot, or when your platelets, the tiny cells that stop bleeding, start to disappear, petechiae begin to appear, silently, slowly, then suddenly in more and more places. For people over 60, this is no small warning. Petechiae can be an early sign of serious blood disorders, including platelet deficiency, autoimmune conditions, vitamin deficiencies, or even certain forms of cancer like leukemia. It doesn't mean you have any of those, but it means something deeper is off. And the earlier you catch it, the more time you have to fix it before things get worse. Let's talk about the most common causes. The first is a drop in platelets. Your body needs platelets to plug leaks. When levels fall too low, even the smallest pressure, a bump, a rub from clothing, a minor strain, can cause capillaries to break open. In some cases, this happens after an infection or certain medications. But in older adults, it can also point to bone marrow problems, chronic inflammation, or even silent internal bleeding. If you notice petechiae appearing in clusters, especially on your lower legs, it's time to act. Not tomorrow, now. Another cause is vitamin deficiency, especially vitamin C. This isn't just about immune support. Vitamin C strengthens blood vessels. Without it, your capillaries become fragile. This was once known as scurvy, and while we think of that as a disease from history books, it still happens today, especially in seniors who eat very little fresh produce. Petechiae on the skin, plus fatigue and joint pain, could be your body screaming for vitamin C before bigger damage begins. Autoimmune conditions like ITP, immune thrombocytopenic purpura, can also trigger petechiae. In these cases, your immune system starts attacking your own platelets, and since platelets are what stop bleeding, you begin to leak under the skin, not from trauma but from the inside out. It may start as just a few spots, then more. Then maybe you notice bleeding gums or blood in your urine, and by then you've already waited too long. Certain blood cancers like leukemia can also show up as unexplained petechiae, not in every case but often enough to take it seriously. The problem isn't the skin, it's what the skin is trying to tell you. The blood is struggling, and your body is leaving clues on the surface. So how do you know when petechiae are harmless and when they're a real warning? First, check how many spots you see. 1 or 2 after a rough night's sleep or wearing tight socks may be nothing. But if you're seeing more than 5 or 10 at a time, especially if they're spreading, that's not normal. Second, press on them. If they don't blanch or fade under pressure, they're likely petechiae. Third, ask yourself, are there other symptoms? Fatigue, bleeding gums, bruising more easily. All of these together point to a bigger issue. This isn't about panic, it's about awareness. Most people ignore petechiae because they're small, painless, easy to miss. But your skin is your largest organ and often your loudest messenger. When your blood is in trouble, your skin may be the first to speak. The dots may be tiny, but the message is huge. So if you've noticed these red or purple dots, especially if they're new, spreading, or showing up without reason, don't ignore them. Bring them up with your doctor. Ask for a complete blood count. Check your platelets, review your medications, get your vitamin levels checked, and most of all, don't wait. Because by the time petechiae become too many to count, the damage may already be far beyond the skin. 2. Itchy skin without a rash. Your skin itches. Not just once, not just after a shower or in dry weather, but all the time, day or night, out of nowhere. You scratch, expecting to find a rash. But there's nothing there, no redness, no bumps, no obvious irritation, just that constant, crawling sensation. And it won't go away. Most people brush it off. Maybe it's dry skin, maybe it's age, maybe it's just nerves. But what if it isn't? What if that itch, that invisible itch with no clear cause, is actually coming from deep inside your body? What if it's your blood? Itchy skin without a visible rash can be one of the earliest and most overlooked signs of blood-related problems. Not because your skin is broken, but because your blood is trying to speak through the nerves, through the skin, through this strange and silent warning. Let's be clear, your skin doesn't itch randomly. There is always a cause. When there's no rash, no allergy, no dryness, the source is often internal. And the older you are, the more serious that can be. One possible cause: liver dysfunction. The liver is one of your body's main blood filters. When it's overloaded, sluggish, or damaged, toxins build up in the blood. And those toxins don't just stay quiet, they start to irritate the nerve endings under your skin. That's why people with liver disease often experience full-body itchiness, especially at night. It's not on the surface. It's underneath, systemic and persistent. And the worst part: it can happen long before other symptoms ever show up. You may not have pain, you may not look sick, but your blood is changing and your skin is feeling it first. Another common and dangerous cause is a condition called polycythemia vera. It's a slow-growing blood cancer where your body makes too many red blood cells. Sounds like a good thing. It's not. The blood becomes thicker, slower, heavier. Circulation is affected. Oxygen delivery becomes uneven. And one of the earliest symptoms is unexplained itching, especially after a warm shower or bath. Many people with this condition go years without a diagnosis because they only notice that their skin itches more than it used to. They don't know their blood is already changing in ways that can lead to stroke, clotting, or organ damage. The signal is subtle. The stakes are not. Even more surprisingly, chronic kidney disease can also trigger this kind of itch. When the kidneys can't filter the blood properly, waste products accumulate. Those waste products irritate the nerves and trigger histamine-like responses, even though there's no rash, no allergy, just that constant sense that something is wrong under your skin. This is called uremic pruritus, and it's especially common in people over 60 who may have undiagnosed kidney issues or long-term high blood pressure. But perhaps the most misunderstood link is between itchy skin and iron deficiency anemia. Yes, low iron can cause itchiness. Why? Because when iron is low, your blood carries less oxygen, your skin becomes more sensitive, nerve endings become hyperreactive, blood flow to the skin is reduced. And even though you don't see anything on the surface, your skin is starved not for moisture but for oxygen, and it lets you know the only way it can. So if your skin itches and there's no rash, no visible cause, no new soap or lotion to blame, don't ignore it. Especially if it's been going on for weeks. Especially if it gets worse at night. Especially if it seems to come from the inside. Ask yourself, are you more tired lately? Do you bruise easily? Has your appetite changed? Do you get more leg cramps? These may seem unrelated, but they're not. They're all symptoms that your blood may be struggling. And the skin is simply the first to report it. Doctors often miss this. They see no rash, so they send you home with a cream. But cream won't fix a liver problem. Lotion won't stop blood thickening. Moisturizer won't clear waste from your kidneys. That's why you have to look deeper. Blood tests, liver function panels, kidney markers, iron and ferritin levels. These are the tools that tell the real story, the one your skin already started. Itchy skin without a rash isn't nothing. It's something worth checking. Because when it comes to your health after 60, the body rarely shouts. It whispers, quietly, through your skin, your nerves, your blood. And if you listen in time, you may stop something serious before it ever begins. 3. Bruising easily without injury. You wake up, look down, and there it is, another bruise. You don't remember bumping into anything. It doesn't hurt much, it just appeared. A blotch on your arm, your leg, maybe your side. At first you ignore it, then it happens again and again. Different places. No clear reason. You start to wonder, why is my skin bruising so easily? It's one of the most common signs people over 60 brush off and one of the most important not to ignore, because bruising without cause isn't just a skin issue. It's often a blood issue. And your body is quietly showing you that something isn't working the way it should. To understand why it matters, you need to know what a bruise really is. A bruise is bleeding under the skin. Tiny blood vessels called capillaries break open and blood leaks into the surrounding tissue. Normally, your platelets rush to the scene. They help the blood clot. The leak seals. The bruise fades. But if your blood isn't clotting well, or if your capillaries are too fragile, even the lightest pressure can cause bleeding beneath the surface. And that's what shows up as a bruise. There are many reasons this can start happening after 60. One of the most common is a drop in platelet count, the cells that help your blood clot. If you don't have enough platelets, your body can't stop even the smallest internal bleeds. You'll bruise from rolling over in bed, from scratching your arm, from nothing at all. This drop in platelets could be caused by certain medications, autoimmune conditions, or deeper problems with your bone marrow where platelets are made. Another cause: vitamin deficiencies, especially vitamin C and vitamin K. Vitamin C keeps your blood vessels strong. Without it, they become fragile and burst easily. Vitamin K is essential for clotting. If you don't have enough, even a small bruise can spread wider and darker than it should. Many people over 60 develop these deficiencies without knowing it, especially if their diets are low in fresh greens or if they take medications that interfere with absorption. But sometimes, easy bruising isn't just about missing nutrients. It's about what your liver isn't doing. The liver produces proteins that control clotting. If the liver is struggling due to age, alcohol, fatty liver disease, or long-term medication use, those clotting factors drop. And so do you. The bruises show up more, they spread faster, and they take longer to fade. If your liver enzymes are off and bruising becomes more frequent, it's a warning your body can't afford to whisper. Then there are blood cancers like leukemia. Yes, bruising is often one of the earliest signs. When abnormal cells take over the bone marrow, platelet production crashes. The body becomes a bruise factory, not from trauma, but from within. If you notice new bruising along with fatigue, pale skin, or unexplained weight loss, you must bring it up. Early diagnosis saves lives, and bruises are often the first visible clue. It's also important to ask, are you on blood thinners? Medications like aspirin, warfarin, or newer drugs like apixaban or rivaroxaban all increase bruising risk. That doesn't mean you stop them, but it does mean you must monitor closely. Because sometimes the line between therapeutic and dangerous bleeding is thinner than you think. And what about aging skin? Yes, skin gets thinner as we get older. Yes, blood vessels sit closer to the surface. But that alone doesn't explain repeated, deep, or spreading bruises. Age might make them more likely, but it doesn't mean they're normal, especially if it's happening more often, especially if the bruises are large, dark, or appear without any known injury. So what should you watch for? New bruises appearing almost daily, bruises that last longer than 2 weeks, bruises that show up on your back, stomach, or chest without cause, bruises accompanied by bleeding gums, blood in urine or stool, or fatigue. Any of these require more than just observation. They require action. Your skin is trying to tell you something. Your blood might not be clotting properly. Your vessels might be fragile. Your platelets might be low. Your nutrients might be missing. Your medications might be too much. Or your body may be showing you the first sign of something serious before it becomes harder to treat. Bruising without injury isn't always urgent, but it's never meaningless. If your body is bruising without reason, then it's bleeding without control. And when that happens too often or too easily, it's time to look deeper. Because blood problems rarely start with pain. They start with quiet, silent signs on the surface. And the bruise you ignore today could be the warning that saves you tomorrow. 4. Skin bleeding or red spots under the skin. It starts with something small, a red patch on your arm, tiny specks on your leg. Maybe it looks like a rash, maybe like pinpoints. You didn't scratch yourself, you didn't get hurt. But something is there and it's spreading. And then one day you notice something worse. You dry off after a shower and see blood on the towel. You didn't even know your skin was bleeding. This kind of bleeding under the skin or through the skin is never normal. It doesn't matter how old you are. It doesn't matter if you brushed it off the first few times. When blood starts leaking through the skin, your body is sounding the alarm. There are two ways this can show up. First, through petechiae or purpura, tiny red, purple, or brown dots that don't go away when you press on them. These are signs of bleeding under the surface. Second, through active skin bleeding, when the skin breaks with little or no trauma and begins to ooze or bleed, often without pain. Both are serious. Both are signs your blood is no longer clotting or circulating the way it should. One of the most common causes is a low platelet count. Platelets are the cells that help your blood clot and your vessels seal. When your body doesn't have enough of them, blood starts to leak into the skin. It's not a cut. It's not a scratch. It's internal pressure from within. Petechiae and purpura are often the first clue, especially when they appear in clusters or on the lower legs. Over time, as platelet levels drop further, you may begin to see actual skin bleeding, small open spots that don't heal, or unexpected bleeding from places like the nose or gums. Why do platelets drop? Sometimes it's an immune reaction, your body attacking its own cells. Other times, it's a bone marrow disorder. Sometimes it's triggered by a virus, a medication, or a hidden cancer. For people over 60, the causes are wide, but the sign is the same: your blood is escaping the system. And when that happens through the skin, it means it could be happening anywhere else, inside your brain, your organs, your gut. What you see on the outside might be the safest place it's leaking. Another cause is vascular fragility, when the tiny blood vessels just beneath your skin weaken and rupture easily. This happens with age, but also with certain deficiencies, especially vitamin C. Without enough of it, the walls of your capillaries lose integrity. They break open under minor stress. Your skin doesn't just bruise, it bleeds. And often, the bleeding looks like a flat, red blotch. You touch it, and it doesn't hurt. But it doesn't fade either. That's blood right under the surface. Blood-thinning medications are another major contributor. Aspirin, warfarin, and newer drugs like apixaban can tip the scale too far. If the dose is too strong or the body is too sensitive, the smallest bump can cause deep skin bleeding. The danger here is cumulative. The more you ignore these signs, the more likely a serious bleed can occur internally. That's why any new bleeding, even small, needs to be reported. In more serious cases, leukemia or other blood cancers may be at play. These diseases often affect the bone marrow, the factory where blood cells, including platelets, are made. When abnormal cells take over, the body can't make enough platelets to keep you protected. The earliest signs might not be fatigue or weight loss. They might be blood spots under the skin. The warning shows up on the surface long before it appears in your lab results. So how do you know when it's time to worry? First, check if the spots don't fade when pressed. That means it's not a rash, it's bleeding. Second, notice the location. Spots on the lower legs, arms, or torso that appear in groups or seem to be increasing are a major red flag. Third, look for other signs: bleeding gums, prolonged bleeding from cuts, nosebleeds, or blood in your stool or urine. These, combined with skin bleeding, point to systemic blood trouble. This isn't about scaring you. This is about catching what others miss. Skin bleeding is not a normal part of aging. It is a symptom, one your body has chosen to show you because the problem underneath is getting louder. And if you catch it here on the surface, you may stop something far more dangerous from happening deeper inside. So if your skin is bleeding or you're seeing new red or purple dots that weren't there before, don't guess. Don't wait. Ask for a full blood workup. CBC, platelet count. Coagulation panel, liver function, vitamin levels. Get to the root before it spreads. Your skin is your first warning, and if your blood is starting to escape, it's time to act before it escapes somewhere worse. 5. What tests to request if you're seeing strange changes on your skin, unexplained bruises, tiny red dots, itching with no rash, or bleeding without injury. It's not enough to wait and see. You need to act, and that means asking for the right blood tests. Because if something is happening in your blood, your skin is often the first place it shows. Start with a CBC, a complete blood count. This one test can tell you a lot. It shows your platelet count, how well your blood can clot. It shows hemoglobin, how much oxygen your blood carries. And it shows white blood cells, the defenders of your immune system. Abnormal numbers in any of these can point to hidden problems like anemia, infections, inflammation, or even blood cancers. Next, ask for coagulation tests PT, a PTT, and INR. These measure how fast your blood clots and whether your body is at risk for internal bleeding or dangerous clots. They're especially important if you're on blood thinners. Also request vitamin level tests, particularly vitamin C, vitamin K, and B12. Deficiencies in these can make your blood vessels fragile and your clotting system weak. Many people over 60 have low levels and don't know it. If you've had skin bleeding or itching, ask for liver and kidney function panels. These organs filter your blood and help prevent waste from building up. If they're struggling, the damage often shows up on your skin first. Finally, if something looks seriously off, like petechiae, chronic bruising, or fatigue with bleeding, push for a peripheral blood smear or a bone marrow panel. These deeper tests check for blood cell abnormalities, including early signs of leukemia or bone marrow disorders. Don't be afraid to ask. Don't wait for your doctor to suggest it. Bring your symptoms, bring this list, and speak clearly. Because the signs are on your skin, but the truth is in your blood.